healthcare sector continues to rise up to the new challenges presented by the ongoing COVID-19 pandemic, which continues to dominate healthcare systems, attention, and resources. They continue to elevate the human experience of the workforce and to reshape how, and where work is performed, swiftly scaling virtual health services for patients, and forging partnerships to produce and procure the required vaccines, treatments, and supplies. 2022 marked the second full year of the COVID-19 pandemic, and it continues to dominate health systems' attention and resources. Despite COVID-19's many devastating impacts, it does present the healthcare sector with a powerful opportunity to accelerate innovation and reinvent itself. COVID-19 has accelerated numerous existing and/or emerging healthcare trends, among them shifting consumer preferences and behavior, the integration of life sciences and healthcare, rapidly evolving digital health technologies, new talent and care delivery models, and clinical innovation. As sector stakeholders and the consumers they serve face an unfamiliar world of remote work, virtual doctor visits, and a supply chain marked by shortages of medical supplies, personnel, and services, the sector is transforming to meet new challenges, and we discuss these opportunities and trends in this webinar for the 2023 Healthcare Sector Outlook. In this webinar, we'll go over the following: the ongoing role of COVID-19, the latest industry trends, and innovation in healthcare. Controlling rising healthcare costs shows up everywhere, from campaign slogans to boardroom discussions. While the idea is not new, we are seeing new and evolving attempts by a multitude of influencers like payers, insurance companies, for example, healthcare subsidizers or purchasers, companies that provide subsidized healthcare to their employees like large employers, and new entrants like private equity and venture capital firms to interject their influence and to achieve this goal. The efforts are blurring the lines of what constitutes a healthcare provider, and consumers are being presented with more options for alternative forms of care. Healthcare insurers are taking the lead. Some organizations are vertically integrating into the provision of care business to mitigate or replace the role of the middleman, like integrated healthcare systems, Kaiser Health System and Kaiser Permanente. Humana's acquisition of Kindred Healthcare was a large-scale example of this playing out in real time. Humana press reports cited creating a payer-agnostic, value-based operating model with a focus on improving patient outcomes and reducing the total cost of care. Highmark Health's acquisition of Allegheny Health Network has proven to be valuable to the organization's members and helps to ensure a competitive landscape in the geography for providers and offers increasing options to the community. Employers are taking notice. On the healthcare subsidizer or purchaser side, companies are trying to limit costs by creating wellness options for employees and delivering in-house telehealth systems, which come at a lower cost and create more flexibility for employees. Some companies have banded together with peers to increase their purchasing power and negotiation with insurers. Walmart, for example, is doing all of the above and more, standing up their own clinics as well. We expect that larger companies are going to continue to practice these new ways of purchasing healthcare for their employees and populations as new ways of managing costs emerge. Health tech is driving change. Alternatively, lower cost care options continue to see interest in investment, recently evidenced by Walgreens. Additional investment in the technology-enabled value-based primary care provider VillageMD. The impetus for Walgreens' growing support is the desire to create an integrated primary care and pharmacy model, providing both better value and access to care. Telehealth in particular has received strong levels of private equity and venture capital support in the wake of the pandemic. Growing use of telemedicine platforms, as well as an increase in other technological advances such as the Internet of Things, remote patient monitoring tools are just two of many options for for garnering more interest outside traditional brick and mortar settings of care delivery. There is, however, the operational impact and the impact on profitability of a focus on cost containment, and the impact that healthcare patient volumes, especially for standalone systems, may experience, because they do rely on higher volumes for higher revenues, typically. Value-based care is not typically an adopted model in the inpatient setting, it's more in the outpatient setting. These factors are likely to affect systems across the provider continuum, however. They could have a long-term impact on profitability, balance sheet strength, and creditworthiness of provider organizations, especially if they're unable to address the asset-intensive nature of what they do in their business environment, in one that requires more agility and other more viable options, such as shifting to telehealth formats, or merging with other health systems, or finding lower cost ways of delivering the same care and better care than they deliver today. We are viewing these new ventures as opportunities for both innovation and alignment, where technological advances in banking tools may help support transformation and value creation in healthcare organizations as they seek partners to help them through inevitable industry change. So while the healthcare industry has largely recovered from the initial shock of the pandemic, it is important to acknowledge the overall long-haul effects of that recent changes have yet to exert. According to McKinsey, the lingering impact related to COVID-19 could cost the healthcare industry an estimated $125 billion in incremental annual costs. It's not quite clear where these are going to show up yet, but they will. Infectious disease protocols, expenses necessary to support them and expand them will continue to evolve. Healthcare providers will need to continue allocating considerable resources to treat COVID-19 in their patient populations as well as their employee populations, and to prevent provider burnout as well. This has been a big challenge lately. And this may prove to be an underestimated challenge, as one of the most critical resources the healthcare system has is its people. And we continue to face staffing shortages, especially in certain professions. Further, organizations may find themselves under external pressure from insurers based on coverage changes resulting from unanticipated complications of COVID-19 care. These considerations all carry significant implications for already thin profit margins in the average neighborhood 5 to 7% for most hospitals and intensive healthcare organizations, as well as for the efficiency of their revenue cycles. Healthcare organizations will need to address the following to mitigate the negative impact of these trends. Accelerating cost transformation. Identifying the potential lasting impacts of the pandemic and quantifying the costs investments necessary to adapt to these long-term impacts will be pivotal. Organizations need to rationalize their real property needs and costs in light of the potential permanence of work from home arrangements, remote care delivery models that require less square footage as an imprint. We may see the potential to monetize these assets and reallocate the resources as these models become more prevalent. Organizations will also need to explore options for automation. Typically in non-clinical tasks is where we see a lot of innovation in that area. One example includes digitizing billing collection and payment, and the posting process to reduce the need for lower-paid non-clinical personnel that handle revenue cycle processes. Creating a competitive advantage to be an employer of choice is going to be critical, considering providing additional flexibility in how non-frontline workers operate on a day-to-day basis, such as allowing for additional remote work, may be necessary, may be attractive to attracting and retaining workers. Healthcare organizations may also benefit from conversations with existing vendors who may offer additional employee-friendly services who don't come with an additional cost. Healthcare organizations have faced a myriad of investment challenges and opportunities brought on by the pandemic. As the world adapts to the new normal and the government looks to ease the level of support provided throughout the pandemic and it tapers off, key asset management strategies are going to be necessary, like managing cash effectively. Due in part to stimulus funding, balance sheets do contain an unusual amount of cash at the moment, coupled with the low interest rate environment, and as until recently, it created challenges for many organizations seeking to maximize return on these assets. So it may be critical in the near future for organizations to assess plans for unrestricted cash and the uses of it, such as as the Federal Reserve begins to taper asset purchases and interest rates continue to go up, with continuing rate increases on the horizon. It's integral that healthcare systems pay careful attention to the duration profile of operational liquidity pools. Considering strategic moves for defined benefit plans, pension plans may see a bump in funding, especially as interest rates rise. Creditworthiness may go up. Pension liabilities typically decrease with rising rates as higher discount rates reduce present value of their obligations relative to the assets they have on the books. We believe it's important that healthcare systems take advantage of this opportunity to functionally lock in these improvements to shift to a higher proportion of liability hedging assets, such as long duration bonds. Internal versus external investment management will also be important. Healthcare organizations have experienced asset growth in their portfolios, except for recent months, over the last, say, 5 to 8 years. They've also expanded their portfolios to more esoteric asset classes, some of which may be at risk as a result of recent events and shakeups in the market. This growth in size and complexity has raised the question of building in-house investment staff versus using external resources like outsourced chief investment officers or consultants. While there's not any one dominant or recommended one-size-fits-all model, I think the goal here is to have many organizations get beyond believing that they're not adequately staffed or that they cannot be, and that flexible options exist to oversee even their investment portfolios when they feel that they need extra expertise to do that. Regardless of their size, a key focus is typically on enterprise risk and operations, which may already require substantial human resources. When considering internal, external management for your organization, consider the complexity of the task at hand, the way that the assets are allocated and managed, their maturities, their plan maintenance and renovation schedules, their objectives for the asset pools, and the associated costs of each strategic option. The coming years will bring challenges to infrastructure and strategy, as well as human resources, and keeping up with innovation and efficiency in light of that. The industry's focus on the environmental and social impacts of their efforts has never been greater. There might be an interest in this topic heading into 2023, thanks in part to the emphasis of industry stakeholders, including investors, who are placing emphasis on social impact. Healthcare is a particular area of very real, tangible social impact. And organizations can take this opportunity to enhance the messaging of their organizations to investors, and find other ways of shoring up confidence in their balance sheets and strategic plans with goals for sustainable financing and capital deployment plans. Investors, consumers, workers, and regulators are likely going to put more pressure on companies to reduce their carbon footprint. promote diversity among employees and leaders, and ensure health equity. As outlined in a recent Deloitte report on ESG, regulators are finalizing new rules that will require companies to disclose their ESG details in their annual reports and mainstream regulatory filings, not typically a historical area of material disclosure. Health equity is a big part of ESG, but not all hospital executives and board members have the same definition of it. Some publicly traded health systems are including an ESG statement in their quarterlies. Some have placed ESG statements front and center on their websites. While the efforts are often focused primarily on the environment, there's broader thinking about the impact ESG has on health equity and the drivers of health in the lived environment. Nonprofit hospitals and health systems are likely to follow their lead, although it could take a couple of years before any real improvements are on the horizon, but particularly among hospitals and health systems that are struggling with margin pressures. Nevertheless, the march forward continues. While large corporate data breaches often make the news, small businesses, nonprofits, higher education institutions, healthcare systems, and other institutions are an increasingly attractive target of cyber attacks. Global losses from cybercrime now total over $1 trillion, according to a December 2020 McAfee report. While large corporations typically have the budget to maintain cutting-edge technology and dedicate entire departments to security, criminals preying on smaller institutions, smaller hospitals, and healthcare systems have exploited limited resources for cyber safety. A successful cyber attack has far-reaching implications for healthcare systems, large and small, for-profit or not-for-profit. A breach harms an institution's reputation and deters partners, employees, donors, volunteers, and other associates from working with the organization. An institution's most sensitive asset is its data. That is very true in healthcare. It's very private information to the individual, and it is the institution's responsibility to protect it. Financial ramifications for not doing so can be very significant. Unfortunately, there's no single impenetrable solution to make an institution completely cyber safe. Cyber criminals continuously find new ways to cause damage. But a commitment to ongoing education and working with well-capitalized technology and financial third-party vendors and partners with adequate, appropriate, specific resources for healthcare to prevent breaches are integral for institutions to protect their data. Going forward, we expect cybersecurity policies and procedures to be a topic of discussion and of interest to investors on a regular basis as capital sources evaluate where to put their money. A demonstrable commitment to cybersecurity could be a differentiator for attracting investment versus the competition. Ransomware. Ransomware and cybercrime are threats that encompass all healthcare practices, whether they are health systems paying out millions in ransom or small practices forced to close from just such breaches. As a result, improved firewalls, multi-factor authentication devices and software, regular training, and third-party vendor security audits will soon no longer be optional. These will be mandatory steps to ensure continued operations and patient health, and providers will have to take those steps in order to obtain cyber insurance. By eliminating disparities and enabling everyone to get the care they need without needless obstacles, we can help everyone achieve optimal health. Those disparities, referred to as the social determinants of health, are systemic. They are part of place, they're part of our lives and behaviors, and can include race, gender, sexual orientation, income, geographic location, and other things. For example, rural communities and areas with high poverty rates in urban areas may have few or no hospitals, medical professionals per capita, per population. The consequences of health inequity can be severe. According to the Centers for Disease Control and Prevention, those that lack access to quality care are more likely to become sick or disabled and to die at a younger age than those who have no difficulty getting the care they need when they need it. COVID-19 has shown a light on health disparities in the United States. The Presidential COVID-19 Health Equity Task Force said in the opening letter of its final report, which was delivered late November 2021, while the events of the past 18 months have made us crucially aware of COVID-19's skewed toll on communities of color and other underserved populations, there has never been a time in which these communities have not suffered disproportionate burdens of death and disease, wrote Task Force Chair Dr. Marcela Nunez-Smith, Director of the Equity Research and Innovation Center at Yale School of Medicine. The report recommends a number of actions, including investing in community-led solutions that address health inequity, enforcing a data ecosystem that promotes equity-driven decision-making, and increasing accountability for health equity outcomes. Finally, investing in representative healthcare workforce. Employers have a role to play here. According to the U.S. Census, about 55% of the U.S. population receives health benefits through employers. This puts the onus on employers to foster workforce equity in healthcare. Dr. Yele Aluko, Chief Medical Officer at Ernst & Young Americas and Director of the Ernst & Young Center for Health Equity, said in a separate interview with Cigna's newsroom team, health equity is an aspirational goal that has not been realized as of yet. It's a circumstance that occurs when every person has the opportunity to attain and maximize their full health potential. This happens when no one is at a disadvantage to achieving this potential, regardless of their social position or other socially determined circumstances. Kimberly Funderburk, Cigna's National Vice President and General Manager for Government and Education, recently spoke about employer initiatives around health equity and the ways that health disparities negatively impact our workforces. During a Cigna panel discussion, she said, health disparities don't stay at home when we go to work. Since our workforces reflect the communities we are in, we bring them to work. Finally here, the key takeaways would be that public health systems are facing persistent clinical, financial, and technological challenges across the service ecosystem, across the care continuum, all exacerbated by a heightened demand for services and a competing environment of escalating costs and difficulty finding and retaining workforce members in several of important healthcare professions key to managing the COVID-19 pandemic and all of the other healthcare that occurs around normal days. This has all been a net impact with underserved clients and uneven outcomes across the range of support for vulnerable individuals and families. There's an unquestionable need to reimagine and transform struggling and constrained public health systems into ones that are human-centered, inclusive, and resilient to future shock. Thank you very much for the opportunity to speak with you. This has been Mark Wesson, Principal of Healthcare Development Consultancy. Thank you for your time. That's my idea on the 2023 Healthcare Outlook.